Hi, and welcome back to the WHY-O-MYO podcast. This is Janine Steen, your host, hoping to answer your questions about the who, what, where, when, why, and how when it comes to myofunctional therapy.
Disclaimer. All content, details, as well as education shared on this podcast are the opinions of the speaker and are for informational purposes only. Please consult with a certified medical professional regarding any questions or concerns, as this podcast should not serve as a diagnosis or replace the information received from a healthcare provider.
Hi. During the last podcast, I spoke a little bit about sleep apnea and the benefits of both myofunctional therapy and a new appliance that I created and patented and is being sold throughout the United States and worldwide, that it's called the Spot Pal. And the Spot Pal is designed to address many areas. It's actually become like the running joke. If I say, my nose is running, can the Spot Pal fix it? Believe me, I want it to. Or can the Spot Pal make me skinny? I wanted to do that also. However, I haven't gotten there yet. But I will say that the Spot Pal is an appliance that I created and patented throughout the many years that I have been a myofunctional therapist and my many years of training and shadowing and growing and creating my own myofunctional therapy program. I have been lucky enough to have 5 million therapy sessions through the offices in the last 54 years. I purchased the practice from a gentleman that was primarily doing myofunctional therapy. His name is George A. Surlis, and he really taught me the background and the foundation, and I shadowed him, and he introduced me to his colleagues and the people he refers to and the people that refer to him. He really walked me through what being a business person was, because I did not know, I was not a business person, and but also really taught me what myofunctional therapy was and how to do it and how to do it effectively. And so George, fast forward, he is trained in the Daniel Garliner's approach, and that's initially what I learned. And then my trainings just continued to grow and evolve from there. And that, in combination with these 5 million therapy sessions that have crossed through one of my offices at one time or another during the last 20 plus years, I have been able to see enough therapy sessions and enough evaluation sessions and enough reevaluation sessions and enough treatment sessions where I was working directly with a patient to see what some of the limitations were of the products that were out there, not for any other reason except that it wouldn't allow my patients or our patients, or the patients of the practice and the patients that were doing this therapy approach that I created, doing it well or doing it effectively or actually doing it at all, because some of the appliances that are utilized for habit breaking per se, like a tongue crib or a rake, they are often really too intrusive for children with tongue thrust because their oral cavity or their mouth is usually really tiny. And I know that sounds crazy, like a universal statement that their mouths are really tiny, but a lot of that tininess, that's not the word, but a lot of that size limitation is because the tongue has pushed the palate, the hard palate up so high, and it's become so narrow that there's not enough space for the dentition as well as the tongue. So when you put something intrusive into an individual that has a tongue thrust and their mouth is really small, and now it's really intrusive, and this patient also, remember, their tongue is weak. So when they lay down, especially on their back, their tongue is going to fall backwards, so to speak, or they may have enlarged adenoids or enlarged tonsils and their airways being compromised. Now take this really intrusive rake or crib in their mouth. They feel like they're choking on it. I can't tell you how many patients have literally ripped it out of their own mouths in the middle of the night, and it adhered to the teeth, so it's not easy to rip it out. And then the only other appliance, go back to the rake and the crib, is that we can't do myofunctional therapy or our spot myofunctional therapy program with a rake or a crib in place, excuse me, because it interferes with the development of the muscle strength and agility, but placement, because what happens is the tongue just, because it can't push forward or thrust forward because the rake or the crib is there, and that's supposed to deter the tongue, the tongue tip becomes callous, for a lack of a better word, and they'll just rest their tongue on it. So what happens is when that comes out, the tongue just goes right back and falls onto the teeth again, because nothing has been addressed in terms of the musculature on either side of the tongue, on the lateral margins. So they didn't learn how, they don't have the strength to keep their tongue up there naturally, and if it doesn't have something to lean on. The other thing we often see is, okay, they were thrusting on their top teeth. We put this rake or crib, they're able to tolerate it. Well, now they're thrusting on their bottom teeth. So we've just treated one issue for another. And then the only other areas or other devices or I should say the only device that we recommended was lingual spurs or tongue tamers. But what those are, they adhere to the back of the teeth. And if your tongue goes too close, it gets a little prick or a stick. Nothing intense, but just as a reminder, a deterrent to keep it off the teeth. But you cannot use clear aligners or Invisalign with those on your teeth. So that means you would have to use a traditional retainer, and I don't even know how it would work with that. So evolved, all of that information, that's what goes on in my brain, just so you know, that's how the Spot Pal came to be. So with all of that, and then COVID happened, and we had to switch from in-person myofunctional therapy to virtual myofunctional therapy. And my biggest fear and concern, and what was giving me a pit in my stomach, was I can't see inside my patients' mouths very well, and I don't know if their tongue is sitting where it should. I can't tell if it's too far forward, too far back. I can't tell if they're using compensatory strategies, if they're as effective as effective is a great way to say, with the exercises, because I can't really see them. So between all of those sessions and the limitations of what was out there, and then in comes COVID, the Spot Pal came to be, and the Spot Pal is designed to allow for subconscious training while using an appliance, obviously you're conscious of, but something that we could use with a patient while they were asleep, or they could wear it in school and they can talk with it, and it's not really visible. You can't tell it's in. So they don't mind wearing it in school. So now where we would usually get, practice 3 times a day, and, maybe we get twice, and it's only for 10 minutes and 10 minutes. Now you put a Spot Pal in, and you are literally working your tongue all day. And it could be all night as well if you wanted to. And that's accelerating our patients' progress and their success, because in all of these passive therapy moments, they're practicing and keeping their tongue where it needs to be and improving their strength by just passively wearing this appliance that's not intrusive and will not interfere with their ability to communicate. So at this point, we have seen great success with Spot Pal and sleeping and decreasing snoring, improving more decreasing restless sleep and improving more restful sleep, less tossing and turning. So we've had multiple patients write in. We've had multiple patients' wives reach out as well, and very grateful. And as I said in my last podcast about sleeping, I'm one of those wives, and I am insanely grateful. We're also using SpotPal and seeing success with patients that have TMJ, or temporomandibular joint disorder. Some people may not know they have it. It's like one of those other areas that we don't look for until we start to see issues evolve. So temporomandibular joint disorder is usually when you feel clicking or popping by your ears when you open and close your mouth. Or your jaw gets locked in a certain position, or it's really hard to open your mouth in the morning. You may get headaches. You may feel a lot of tension in your jaw, tension in your shoulders. So you may grind your teeth. All of those things are signs of a temporomandibular joint disorder. And again, if you have that diagnosis, or you just know that you have some of those symptoms, individuals have been utilizing the Spot Pal and have reported a less tension in their face, less overall pain, less symptoms, headaches, jaw locking, teeth grinding. They're reporting a difference with that. The dental providers are saying they're seeing less wear on the teeth when the patients are wearing it. So that's really exciting. And the feedback we have received from patients has been really eye-opening as well. And then Spot Pal is, because it is a tongue training appliance and works on proper alignment and making sure the jaw and the tongue are in proper alignment, it works to improve the tongue's resting posture and nasal breathing versus mouth breathing. And people often think it's not a big deal if you're a mouth breather. Sometimes people say they're a mouth breather, but really they're just breathing with their mouth open. Those are two separate things, and they're not interchangeable. If you are a mouth breather, meaning the primarily inhalations, anything you take in is with your mouth open, you're really not sniffing or breathing through your nose. When you're a mouth breather, a couple things happen. Your mouth is open, your tongue hangs low in your mouth, and any bacteria or pollutant or irritant in the air, you're inhaling it. There's nothing filtering it like the cilia of your nose. If anything, you're inhaling it right back towards the posterior portion of your oral cavity where your tonsils would be. And oftentimes you're getting sick more often because you're inhaling those germs and nothing's filtering them through the nasal cavity. You'll also find that your mouth gets dry, your vocal cords may get dry, and then you become hoarse or have the quality of your voice changes. So besides working on keeping those lips closed and breathing through your nose, we want to make sare that those nares are both clear, that you have the ability to breathe through your nose. And if you don't, why, and can it be treated? And while we're working on breathing through your nose and keeping your lips closed, we're working on your lip strength to make sure your lips have the ability to stay closed. But we're also working on the tongue posture and the pattern of your tongue. So making sure that it is resting in the proper place, which would then maximize the ability to support the growth and development of the hard palate. Hopefully make some changes with that hard palate. If they're get the tongue off the teeth, hopefully that will improve the overall occlusion. And last but not least, while doing all of those things, breathing through your nose, because when your tongue is in its proper position and where it should be resting and the appropriate place where its contact is optimal, that is again is shaping the hard palate. But that contact also is your swallow. That is your calming, and this calming quality that occurs when you make that tongue contact to the hard palate. But the other thing that it is doing is, aside from soothing and making the contact to help it grow and develop to its proper size, you cannot breathe through your mouth if your tongue is in that position. So even if your mouth was open, you actually can't inhale. So it really does support that ability to say, okay, I know exactly where my tongue needs to be. The spot pal is showing me that. My tongue is not touching my teeth because the spot pal is helping that. I'm keeping my lips closed, where myofunctional therapy is building that strength. Or I have a handle on my spot pal and that is supporting lip closure. And now I am breathing through my nose. Again, all with spot pal. And I promise I'm almost done. The other thing that Spot Pal has been successful with is with our patients that have a tongue thrust. We're using Spot Pal with our Spot Pal therapy program in office and our own in-office myofunctional therapy program. So our patients that are using the Spot Pal in our office are getting the best of every avenue. They're getting, all of our therapists are prompt trained, all of our therapists are feeding trained, all of our therapists are spot myofunctional therapy trained, all of our therapists are now Spot Pal therapy trained, and your patient in our office gets all of that, all wrapped up into one neat little package with a bow, and we're seeing accelerated success. For an individual that is not coming in for myofunctional therapy, then you can participate with a Spot Pal. You can participate in Spot Pal therapy through our modules, or you can utilize a Spot Pal and do just our introductory program to get you acclimated and see if you're starting to see improvements, and if so, then move on to a tongue training program, or I should say the Spot Pal therapy program. Or for some individuals, once you understand what needs to be done and how it needs to be done, you can start incorporating it into your day and see if you need additional support, or are you putting it in and using it and getting your desired result without needing to go through Spot Pal therapy? That definitely could be the case too. It's also really great for those patients that are maybe in a myo program or an oral motor program, and they need to take a break, or it's the summer. As a school therapist, you're worried that they're going to regress over the summer, or if they're a patient and they lose their insurance, or they need to take a break because of baseball and soccer and all these other obligations. I would highly recommend I would highly recommend them getting a spot pal, because at least, again, they can utilize it with the exercises so they don't lose it, but they can all lose or regress. But they'll also be able to get that passive therapy that, in the absence of a structured therapy approach, and that therapy that happens passively, at least they're getting one of that, one area definitively. And if you can get your child to practice even a little bit, maintain some of their skills, the majority of skills, all of their skills, but definitely limit regression. So, that is one of the other areas that makes it fantastic. There's two more still. The other thing that we're utilizing myofunctional therapy, we are using that, spot pal for, is for habit breaking. So, as everyone knows, that if you suck, I think everyone knows, if you suck a thumb, a finger, bite your nails, suck on your shirt, suck on your tongue, that can have just as a detrimental effect on your teeth and your palate and the structures of your mouth, just as significant as the tongue by itself. Or it's just catastrophically bad that, we can't put you in a therapy program to address a tongue thrust if you purposefully take specific opportunities throughout the day and just repeatedly thrust. So, sorry, that was a little cryptic. So what I'm saying is, do you or your child, or your patient, suck their thumb, suck their finger, suck on their shirt? I think I was just saying all these: bite your nails, suck on your tongue. And it can literally, there are times when we open a patient's mouth and you can see like the imprint of the thumb and how the bone of the hard palate shaped or was malleable around that thumbprint or the fingers. It's actually a little creepy. And you can see how the teeth are flaring. And when you're talking about a toddler, the sooner that thumb is out of the mouth, and more importantly, that we start conditioning, that child to keep their tongue in their right spot, that palate is still malleable. So if we can take the extrinsic issue away, which would be the thumb, the finger, deter and keep the tongue away, the nails, the clothes, whatever, the pencil tip, if we can do that by utilizing a spot pal, and at the same time, they're going to keep their tongue in their proper position and reshape their hard palate, there's time still, especially when you intervene early, to change it. I can't tell you how many kids have the most horrific bite in this huge space, and their palate is so high, so narrow, but we are able to intervene early enough and get the extrinsic item out of the way, and put them in a spot pal and see just tremendous progress. Some patients that were destined for palate expansion do not need it anymore, or didn't require it because there was such a change. Or they didn't need as an intense of a program, or an intensity of ortho or orthodonture, or the time frame was cut significantly because so much happened by just intervening early. So, and I will say this, that you can do things to eliminate the thumb, you could do things to eliminate the fingers, the shirt, the pencil, a pacifier, but you cannot eliminate the tongue. So this is the only appliance that can deter and interfere with not only tongue sucking, but tongue thrusting. And that's tremendous because we can't take the tip of the tongue off. And when you engage in any of these noxious habits, the first thing that happens is you bring that item to your mouth and the tongue will meet it there. And think about a bottle, think about a nipple of a bottle, think about the breast. That's what we were trained to do. And if that perpetual motion continues beyond that early toddler period, and it's being perpetuated because your child sucks their thumb, the longer that happens, the more detrimental the impact it will have on the oral cavity and the structures, and the more intense of a plan will be necessary when it comes to orthodontics and maybe even palate expansion. And the last thing that SpotPal works with, at least for now, is articulation. So the majority of sounds in the English language are produced at our spot or our alveolar ridge. The SpotPal not only is it customized so that everybody's spot is exactly where it is in their own mouth. It's not universal. Every appliance is custom to the patient's bite based on their overall occlusion, the teeth they have, the teeth they lost, their teeth that are loose, or that they're post braces, or they're in retention, or they're post expansion and in retention. So every appliance is completely specific to each patient and what they need it for. So for articulation, it gives the spot where the tongue needs to be for the majority of the sounds in the English language. And because the SpotPal also works to address and deter lateral, unilateral, or bilateral thrusts, it is also there's something called the SpeechPal, which is a SpotPal with specific places that are noted that allows your tongue to produce or support the production of the R sound, the vocalic R, like in bird, not the traditional R, which would be in road. You want that bird, that vocalic R, it's called. And it also, the SpeechPal also has the ability to help shape, with guides to help shape the SH, the CH, and the J sound, as in judge. So it's not 10 different SpotPals. They're not all separate. Actually, each SpotPal has the ability to do all of those things. And if you want more information about it, please go to our website. It's thespotpal.com. If you want to know if you're a candidate or one of your patients is a candidate or a family member is a candidate, take the questionnaire, and someone in my office will get back to you, and hopefully we can help you and your patients not just succeed with SpotPal, but make that myofunctional therapist or that speech therapist look good for intervening early and making the recommendation, and make that dentist and orthodontist look good, because the intervention you're providing has not only been done in an expedient manner, but has also yielded long-term success and limited regression. And last but not least, our ENTs, hopefully we will be able to limit how many patients that we're concerned about in terms of not having intervention for sleep disordered breathing, and give them the support to build that strength, especially in individuals that are not necessarily a candidate for any other medical intervention.
I hope I was able to give you some insight and answer some of your questions regarding myofunctional therapy. Please stay tuned and listen to our Myo Minute, and tune in to our Talk the Talk interviews with the many different medical, dental, and rehab professionals as they elaborate or answer your questions and address your concerns directly, especially when it's related to speech-language pathology and myofunctional therapy.